Hello everyone, my name is Abdul Muiz Alam Kiani. I'm a second year internal medicine resident at Advent Health Tampa. The topic that I'll be discussing today is regarding the efficacy of SGLT2 inhibitors in improving cardiovascular outcomes in patients with acute coronary syndrome. Acute coronary syndrome is a manifestation of coronary artery disease resulting from decreased blood flow to the cardiac musculature. It includes unstable angina, non-ST elevation myocardial infarction, and ST elevation myocardial infarction. The prevalence of acute coronary syndrome is high, with 1.2 million people being hospitalized each year in the US. Patients with acute coronary syndrome remain at a higher risk of experiencing adverse cardiovascular events, with a cumulative incidence that approaches 28.6% at 5 years. Sodium glucose cotransporter 2 inhibitors primarily act by inhibiting the coupled reabsorption of sodium and glucose in the proximal tubules. The exact mechanism of cardioprotective action of SGLT2 inhibitors is unknown, with several mechanisms being proposed, such as natriuresis, blood pressure reduction, improved cardiac energy metabolism, and prevention of cardiac remodeling. SGLT2 inhibitors have been previously associated with a reduced risk for heart failure hospitalization and cardiovascular death in patients with heart failure with reduced or preserved ejection fraction. However, there is limited evidence regarding the efficacy of SGLT2 inhibitors in patients with acute coronary syndrome. This meta-analysis aims to assess the efficacy of SGLT2 inhibitors in patients with acute coronary syndrome. With regards to methods, a literature search was conducted in PubMed Medline, Web of Science, Ovid Medline, and Cochrane Library. Outcomes measured to assess the efficacy of SGLT2 inhibitors following acute coronary syndrome included risk for heart failure hospitalization, myocardial infarction recurrence, cardiovascular death, all-cause mortality, and major adverse cardiovascular events. Major adverse cardiovascular events was defined as a composite of cardiovascular death, all-cause mortality, heart failure, non-fatal stroke, non-fatal myocardial infarction, and coronary revascularization. The outcome measures were reported as odds ratio using a random effect model with 95% confidence intervals. With regards to results, a total of 13 studies with 17,971 patients presenting with acute coronary syndrome that included 17,816 patients with myocardial infarction and 155 patients with unstable angina were selected for analysis. The mean age of the patients was 61 years, and the pool included 8,406 patients with type 2 diabetes and 9,565 patients without diabetes. Initiation of SGLT2 inhibitors was associated with a significant reduction in risk for heart failure hospitalization, with the odds ratio of 0.68 and the forest plot being shown at the top center, and major adverse cardiovascular events with the odds ratio of 0.45 and the forest plot being shown at the bottom center. Both of these results were associated with a low heterogeneity, with heart failure hospitalization and major adverse cardiovascular events having a Higgins I2 of 11% and 0% respectively. Although the incidences of all-cause mortality, cardiovascular death, and myocardial infarction recurrence were lower in the SGLT2 group, these results were not statistically significant. With regards to discussion of the results of our meta-analysis suggest that initiation of SGLT2 inhibitors in patients with acute coronary syndrome is associated with a statistically significant reduction in risk for heart failure hospitalization and major adverse cardiovascular events. Initiation of SGLT2 inhibitors is especially important in patients with acute coronary syndrome, considering these patients are already at a higher risk of experiencing future adverse cardiovascular events. These results suggest that the cardioprotective role of SGLT2 inhibitors extend beyond patients with heart failure, resulting in improved clinical outcomes in patients with acute coronary syndrome. So in conclusion, SGLT2 inhibitor therapy is associated with a significant reduction in risk for heart failure hospitalization and major adverse cardiovascular events in patients with acute coronary syndrome. Thank you for your time and have a great rest of your day.